Thank you for inviting me here today to present to you. I know not all the audience are nurses, so I do apologise, but try not to switch off and think about communication, think about how you can use the Royal College of Nursing, how you can use your nursing profession where you are working. So I just wanted to give you a bit of an idea about what the Royal College of Nursing is about. Okay, so it's the largest nursing organisation with over 435,000 members. There is a UK-wide and international membership, and it represents members and members' interests. And how we do that is we have up to 35 different types of forums. So we have the Continence Care Forum, which is what I'm the chair of. There is Public Health Forum. There is Gastric Forum. Children and young persons. So whatever area you work in, whether it's community, private sector, there are forums that might be appropriate for you to be a member of. We have Facebook pages, we do Twitter, we do blogs, we have websites. So we can engage with members and members can engage with the RCN. Obviously we are a union as well, but it is member nurse led. And we do promote and engage in nursing research. So how do we do that? So we produce evidence-based and consensus professional standards. So there, for example, I'm going to present to you today our catheter guidelines and our lower bowel dysfunction guidelines. We can collaborate, work with partners. So we might be working with the Infection Prevention Society. We might be working with Age UK. Maybe on a piece of work about patient information, raising standards. We endorse pieces of work, so we might get approached by companies, organisations with training packages, and as an organisation we will help to endorse. We can contribute, so nice guidance. Nice guidance will come into the RCN. The RCN will then filtrate whatever is relevant to particular forums, so that it gets a broad member's perspective of nice guidance. We can help influence. So some forums and some professional leads will sit on all-party parliamentary groups to help steer and develop changes. Just recently, there was an alert relating to bowel care and not providing bowel care, so we were able to put our endorsement and support the work on that. NHS Excellence in Continence Care is something that we've also worked in partnership with. So I've just given you a list of some of the RCN publications that I hope that some of the nurses are aware of. So we've got Essential Practice in Infection Prevention and Control, Creating a Strategic Focus to Support Prevention of Infection, and then Infection Prevention Society we work with in Infection Prevention and Control Commissioning Toolkits. So one of the ones that obviously sits with me, which I'm really interested in because I am the bowel nurse, I love bowels, and that is about the management of diarrhoea in adults. And the RCN guidelines, we're updating those currently. So I say it's about working in partnership. What we aim to do now with these guidelines is rather than be having paper guidance to hand out, on the internet, you'll be able to access them, and there will be links to supporting information. So, what have we updated? Anyone aware of the anyone aware of the catheter guidelines that we've done in the past? Find that a useful tool? We ensure that it's competency-based skill. We map it to skills of health and national occupational standards. And we ensure that it's standardised across the UK. So how we've done that is we've linked with our forum members within the RCN to say what's happening in Scotland, what's happening in Wales, what's happening in Ireland, just so that we can pull it all together. It's best practice versus minimum standards. And I think that reflects on the changing workforce we're in now. Years ago, when I was in urology, you would have male nurses doing male catheterizations, female nurses doing female. And now in our community, we have other healthcare professionals, we are delegating catheterisations and invasive procedure to a healthcare support worker in some organisations. So we are changing, aren't we, in our management, our delegation. So what we want our guidance to be is adaptable so that it can be used in the acute, the community, the private sector, but we also want it to be consistent. So as I say, this is my baby. The management of lower bowel dysfunction, including digital rectal examination and digital removal of faeces. You're probably thinking, what am I doing? Why am I here today? So this document is being launched very soon. Its key audience is for nurses, and we're mapping it against new guidance. So we're looking at Public Health England, we're looking at Health Protection Scotland, the multidisciplinary associations for spinal cord injury professionals. We work collaboratively with them to ensure that we're working together, saying the same things. But things that we have more in depth in this time is about looking at hand hygiene. It's looking at handling and disposing of body waste and environmental and equipment. So this is where I suppose I'm asking you as the infection prevention specialist, engage with the RCN, let us know, are we not supporting your messages that are going out to those nurses that are providing the care out there? How can we support you to push the information, to keep it updated, to keep it live? So, as I say, with the infection prevention and control chapter, we have made it more in depth. We have looked at the 4 nations more to make sure that we are giving the right information. Predisposing medical conditions and factors that can be causing diarrhoea. So before, there was just a brief chapter on diarrhoea. Now, why has that person got diarrhoea? What is the assessment? Let's assess that person to see what's going on with them. Is there a disease process? Is it a medication? Have they been in contact with somebody that has an infection? Care of the environment. We work in communities, we work in people's own homes, we work in hospitals, being aware, raising the profile again about awareness to that practitioner of the environment and if they have an infection. We've embedded site again into the document, which was from the Department of Health 2009. And again, that's where I look to you. Are there things out there? Is there a change that will help us to share that information with the nursing profession? So I would have handed over to my colleague Sharon, but unfortunately she couldn't be here today, so I hope I do this justice for her. So, catheter guidelines. There's been lots of things going on throughout the day related to catheters and UTIs, problem solving of catheters. And it's been really good sitting in with the catheter toolkit this afternoon and to make sure, again, that we are all supporting each other. So, again, it's a holistic professional nursing resource which includes the prevention of infection, and it's been developed by members from a specialist bladder management perspective. So again, we linked with infection prevention nurses within the forum, continence, bladder and bowel specialists, what you're doing out there, what's common practice, what research is happening. We also have a research forum as well, which is most useful. Will have an impact on all elements of care and managing not just infection prevention. So, catheter care, key audience, healthcare professionals, mapping against new guidance. So we've got the NICE guidance with urinary tract infections, catheter prescribing. Obviously, we've got the new catheter tool that's just being launched, so we'll be able to embed that within the catheter guidance. Reflection on clinical evidence in Europe as well. So we've got connections within the European world of continence, urology, so we can link in with specialists there. Again, hand hygiene, handling and disposing of body waste, environment and equipment. So catheter passports. This was obviously those that could attend, really interesting subject about having an individual pathway, an individual catheter passport for that person. So it was more about that individual, and information was all relevant for that person. This is also embedded within our guidance. Antibiotic prescribing. We've also embedded HOUDINI, which is in the latest catheter passport. So it's about raising the profile why you are doing that catheter. It's about managing appropriate catheterization. So bladder washouts and catheter maintenance solutions. I think there's been maybe a few subjects around that today, a few discussions. So we found it really hard about having evidence to support practice. Bladder washouts are usually used in the acute setting. Catheter maintenance solutions is how we've used it, termed it within the guidance as well. Because what we want to do is change the way that things are being done within the community. Syringes coming out into the community to do bladder washouts. The idea is about maintaining the catheter. Are they at high risk of infection? Are they at risk of sepsis? What is the rationale behind the use of a catheter maintenance solution? And are you aware of the antimicrobial catheter inflation solution that's out at the moment? Sharon has done a lot of work trialling those catheters, and it's an installation within the balloon, reducing incrustation. So that's let's see how that let's watch and see how that one works for that individual. So it's out there, and we need to look at it and see how it fits that individual. So in the guidance, I haven't got a clip on here, but what we have is a decision-making tool. And in that decision-making tool, it's about, is the catheter bypassing or blocking? If it is, what can we do about it? So we're hoping that the nursing profession are going to have support with that, making decisions around why they should use that catheter, why they should use, A, should they have a catheter, and B, if it's blocking, what could it be? So are there conservative things? Are they constipated? Have they got the bag in the wrong position? Do they have a fixation device? Is the catheter bag right down the end of I know sometimes gentlemen like to use a catheter bag down by their leg, and that can cause bladder mucosal occlusion and can stop the catheter draining. So it might come across as a blocked catheter, but it might not necessarily be that. It might be reposition the catheter. So there are lots of things that we can think about, and this tool will support you with that, rather than just going straight in and do, maybe I need to see if that catheter's blocked and do an installation, do a catheter maintenance solution. It's about thinking about what are the simple causes. Is the catheter tip touching the bladder and causing a bladder spasm, and therefore they are leaking urine every time they get a bladder spasm? What can I do? Will a fixation device help that? There's always more than one solution, and that doesn't mean catheter maintenance solution. There could be more than one solution. So it could be constipation, it could be a fixation device. But solutions, they are being used. In some areas, they are not being used. You have normal saline, you have SUBI-G, SUBI-R, which we have put in the guidance to give some information so that nurses have informed choice about what they use and why they use it. Thank you for your time. Just to let you know, we do have a Facebook and a Twitter as well. So, as I say, from a nursing perspective, use the RCN, get involved. We can help support you and vice versa. Thank you very much.